Good morning or good afternoon or good night, wherever you are tuning in from. This is Harmony, your podcast host. Welcome to all of our Ayurveda and Women's Health Sisterhood members who are joining us live in the Facebook group, and to all of our wonderful podcast listeners. Today we have a really interesting episode, and we're going to be talking about what your blood work is really telling you from a functional medicine point of view. Now, I love geeking out on this science, so I'm super excited to have the Dr. Elizabeth Davidson with us, and she's a holistic doctor, a functional blood work specialist, clairvoyant, plant medicine expert, entrepreneur, author, forager, skier, and single mom. So she's a whole lot of things. And she says that everyone's health is a puzzle, and she combines science and intuition to help people put that puzzle together, solving chronic illnesses, autoimmune disorders, and helping people live their best lives. So I feel like we already have a lot of things in common. So I'm going to really enjoy having a chat with you, Dr. Elizabeth. Welcome to the podcast.
Oh, thank you so much for having me. I'm really excited to be here.
You're so welcome. And I always start my podcast episodes with our rapid inspiration questions. So can you please inspire us with what your superpower is?
Oh, my superpower. Well, my daughter calls me the good witch.
Oh, nice.
And what that means though is that like my superpower is I'm really good at solving things, whether it's health related or pretty much anything else.
Perfect. Well, that makes for a good health practitioner then, right? And what is your favorite quote or mantra at the moment?
I probably can't quote the whole thing, but it's something Marianne Williamson said a long time ago about um, we don't like our mission is not to be quiet and to be small. It's we're living our best when we're big and we're out there and presenting what we're called to do. So that's a horrible paraphrase of her quote, but it's often.
I know the quote. I absolutely love it. I've like got it everywhere, and I'm like thinking, oh, well, surely I could find this easily, because it's like it's a quote that I've shared with students and myself in the past.
Yeah.
I totally get you. It is one of my famously favorite quotes as well. Just it is it our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us, like along those lines, that one?
Yes, that's the one. It's often credited to Nelson Mandela, but it's Marianne Williamson.
Yes.
Because he like said it in his inaugural speech or something.
I'm all on board with that. Love it. One of my favorite quotes as well. And last one, who or what is inspiring you at the moment?
I'm taking a lot of inspiration just from like being interviewed on a bunch of podcasts recently and meeting all these people all over the world that are doing such cool things. And that part of the inspiration with that is that there are so many people now who are really curious and putting a lot of effort into promoting holistic well-being and putting health, the power of health back in the people's hands, like not so much in the medical system's hands. You have a smoke alarm going off? So that's really inspiring, just to be meeting so many people who are kind of in that same mission. And you're muted.
Yeah, I cannot.
You need to be.
My alarm is going off. There's no smoke. Just give me 1 second to check this out.
Okay.
All right, we are resuming recording after my smoke alarm just scared the shit out of me and completely alarmed the whole neighborhood. Don't worry, there's no fire in here, but we have solved the problem. So now let's continue with the episode. Beautiful. So thank you for sharing those rapid inspiration questions and answers with me. I too absolutely love podcasting for that reason. As you mentioned, I have made so many friends and fantastic connections all over the world through my podcast. So grateful to have this platform. So I totally agree with you there. So to get into the episode, what do you do and how did you get into your line of work in the realms of functional medicine?
Well, it started with being really sick my whole life. So I started having migraines at age 4 and joint pain at age 7. And I took lots of antibiotics as a kid for various things. And so I started having lots of digestive and skin problems as I got like to age 11 and just everything just kept getting worse. And I recognized really early on that Western medicine and all of the medications I was taking and stuff weren't helping me. They were hurting me. And so when I was 10, I started refusing to take them and started changing things. I started playing with my diet. I really recognized that health doesn't come from stuff like from medications and from treatments and stuff like that. Health comes from building it from the inside. And I got inspired around that at about 10 years old. And so have been working in that arena ever since. And so that led me to just discovering lots and lots of things, as you saw from my bio. um, so playing with nutrition since I was that age, I got into like kind of Chinese medicine and stuff as a teenager, and then did more like physical medicine. Um, you know, Experienced a lot of massage and acupuncture and chiropractic, and then I experienced some really gentle chiropractic around age 20, and that inspired me to get a chiropractic degree. So I did that for a while, and that helps lots of people, but it was really hard to stay doing hands-on stuff in the past few years. And I wanted to go deeper still because I was still in pain. So I had been diagnosed with fibromyalgia on top of the migraines and all of that. Chiropractic helped a ton with the migraines and with the insomnia, but the fibromyalgia was still there. And so I got I got this functional bloodwork certification, which has been so life-changing. So that's most of what I do now is I work virtually doing the functional blood work. And a lot of people who are chronically ill and have had autoimmune diagnoses and all of that, they have blood work that is totally normal according to Western medicine. But when I look at it, it's not. So I'm not looking for stuff that's just in normal ranges. Lots of times those ranges are really broad and don't give you a lot of information. I mean, I want to see them within a certain range, but what's more important for me is the relationships between the numbers and what that can tell me. And so this is how I've solved my own fibromyalgia is by using the functional blood work and the protocols that I create around that to solve the issues that I find. And what's been so fascinating is that with so many things, whether it's say fibromyalgia or lupus or anxiety or depression or what else have I worked with? Um, Trouble losing weight, hormonal issues. With all of this, it's often the same root cause that I find in the blood work. And not saying the blood work is the only thing, but finding that root cause there and clearing that out and then supporting all the well-being around that. And that support thing is the other huge thing that I do. I find that a lot of, most people don't have much support from their medical professionals in their lives. And that's so hard, especially when you're dealing with chronic illness that can be up and down and you never know what's going on. And so with my clients, I'm like always on call for them. And I want them to be supported through the whole process. And I feel like what I've done is put together all the things that I didn't get as a sick person.
Mm.
And so I've done all the work. I've done the medical school. I've done the certifications. I've like done all the research and experimented on myself a ton and put it together so that I can help people on a deep level with lots of support. And they actually get well and start living their lives how they want to live them. And it's super exciting and fun.
Beautiful. Yeah, it's often our own experiences that shape the type of practitioner we
For sure.
want to become and the impact that we want to create, because we've either had lack of, or for some of us we have had great support and a really great experience, and we want to infuse that into our practice as well. So I love that you've been able to turn your experience into a positive, the way that you can help your clients. And what was really interesting is that you said that through the blood work, you've discovered that it's often that the same root cause. So can you speak a little bit more about what that root cause is in the pathology that you have discovered with your clients?
Yeah. So where I'm finding that is often in the breakdown of the white blood cells, all the different types of white blood cells. White blood cells fight infections, and different types of white blood cells fight different types of infections. And that's what I'm finding is that pretty much everyone who's dealt with chronic illness at all has at least one type of infection, whether it's bacterial, viral, parasitic, but most of them have a whole host of them. And the more like autoimmune kind of stuff, they usually have all the infections you can possibly have,
Mm,
which, like, no wonder they feel so terrible. Their bodies are fighting all the time and
mm,
using so much energy. So, like, chronic fatigue syndrome,
mm,
what a surprise. You're using all this energy to fight these infections, and you don't have anything, using it all on the inside. You don't have anything for outside. And
absolutely. That systemic inflammation takes a lot to battle.
yeah.
And as you mentioned, like people, they often get their bloods from their general practitioner, their medical practitioner, and they go to get their bloods because generally they feel crappy. Like they're like, something's wrong, don't know what it is. I feel like shit. Can you take some bloods? And it's like the first sort of point of call. And then they go back for their results, and the results are all within normal ranges, but they're still suffering with their symptoms, and they haven't been none the wiser. They haven't got any further answers because the pathologies are within normal range from the allopathic medical point of view. So from a functional medicine point of view, can you explain why normal, quote unquote, isn't optimal, and why people can still be having these symptoms even if they have what is known to be normal pathology results?
Yeah, for sure. So the normal ranges are often really big. Like, for example,
Mm,
the normal range for vitamin D is 35 to 100.
mm,
Most people don't feel good until their level is at 80.
mm.
But if you're at 35, you're considered normal, and there's nothing to be done about that. So, so the ranges are so huge. It's like, trying to find your favorite restaurant between California and Vermont, which I'm in the US, so that's my where I'm my reference point, but that's 3,000 miles, rather than I look at smaller ranges. Like, I want to see your vitamin D between 80 and 100. So it's like looking just in the Northeast or something for your favorite restaurant. Um, and then the other thing that I don't think gets looked at in the medical realm is the relationships between the numbers. So when I look at, like I was mentioning before, the breakdown of the white blood cells, for the most part, if your white blood cells are within normal range, then you're considered fine. But your white blood cells can be in normal range, and there can be an infection present, and that shows up in the breakdown. So there's 5 different types of white blood cells that are done in a differential: neutrophils, lymphocytes, monocytes, etc. And I'm not sure exactly if medical doctors even look at that breakdown. Often they don't run that test.
Mm,
But that's where the infections show up. So they're just not looking for the same things. And y- uh, and the other thing that I see a lot is, even if stuff is out of range, like, for example, I had this one client who had no energy, nauseous all the time, and she's really young too, like 20-ish, and but had been feeling like this forever and just couldn't do anything because she always felt like she was going to throw up. And her white blood cell count was like 11, which is way out of normal range even for a medical doctor. but they didn't flag it. They didn't do anything about it. They're just like, "Oh, you're fine."
So how do you
Um,
remedy the white blood cell counts when your clients come in with high white blood cell counts?
so I'm not like trying to fix the white blood cell count, but I use a, several herbal supplements that will take care of the infections.
Mhm.
A lot of people are like, well, what about antibiotics? And I have talked to several people who have like rheumatoid arthritis or fibromyalgia. The antibiotics really help them feel better, but that's only addressing the bacterial infections. And it just destroys your gut, and there's no system for rebuilding that when people are prescribed those. So I use herbal supplements that will take care of the bacterial, the fungal, the viral, the parasitic, and then rebuild the gut after that, which is key because so much of your immune system is located in your gut, as
Mm.
I'm sure you're familiar with being an Ayurvedic practitioner.
Yeah, absolutely. Gut health for sure, prior
Yeah.
and after. And then I think like, antibiotics gets a really bad rep because of what it can do to the gut and what it can do to our bodies. And we've relied on it for many, many things. And a lot of practitioners may have prescribed antibiotics when they haven't been needed. But I'd also just like to caveat that with antibiotics can be absolutely life-saving and essential for
Oh,
some people. And it's not something that I think a lot of people don't have a lot of education around, and then they refuse antibiotics because they have heard that it's bad for your gut. Meanwhile, they're in excruciating pain with polynephritis, kidney infections going, So I just want to caveat that too. It's about
for sure.
understanding the role that antibiotics play and making sure that they're taken appropriately and that they can be life-saving. And if you have been on antibiotics or do need to go on antibiotics, that yes, your gut health is absolutely going to need a bit of work. And this is where that collaboration piece comes in. You
Mhm.
do need to work with a holistic health practitioner because it does take a long time to rebuild that microbiome and help you out there. But you probably have had the antibiotics to save your life or your kidney or your like whatever it might have been that is crucial for that. So yeah.
Yes, there are certainly appropriate times for antibiotics, but
Yeah,
um, they're way overused too. And
100%. 100%.
key thing with antibiotics, if you're considering taking them, make sure that it's a bacterial infection because so often they get given to people for viral infections and antibiotics don't fight viruses. So
Yeah, absolutely. 100%. And the other thing, like, I guess I explain to my clients about the optimal ranges is that they have been the optimal ranges have been chosen over a period of time from taking the mean, so the median number of blood tests over a range of adults within that range. And a lot of people that are having these blood tests, they might not have disease, but they're not optimally healthy people. So that's why the range is so wide, and it's not necessarily going to apply to you if you are a healthy person and then you fall into illness for some reason or some sort of disease and your pathology results have altered. It doesn't mean anything really if that median pathology has been taken over a range of somewhat healthy people. So I
yeah.
think that's always important to know. And from like a functional medicine point of view, why we narrow the window to more optimal ranges rather than normal ranges. And that's what, like, from my perspective, and I'm sure your perspective, is we look at that optimal range.
Yes.
So when someone is symptomatic, but the pathology reports come back normal, um, and then you have looked at your pathology reports and you're like, well, actually, like your vitamin D is low, or your white blood cell count, like what. And I think we sort of discussed this a little bit, like when we spoke about the white blood cells, so you use herbal medicine. What are some other things that you do to help bring people back into a more optimal range for them?
Well, one of the key things that I do is I do a lot of education. So I love teaching people about what their bodies are doing and why, because I think that's really important.
100%.
And so definitely supporting people with the supplements, I find that is the most effective to actually tackle the infection and whatever else is going on. But then there's the maintaining piece, and so certainly, talking to people about what they're eating and what their lifestyle is like and how they can support themselves in a whole way. But the biggest thing I think is letting people know that their bodies are amazing and that their bodies are doing all of this stuff that doesn't feel very good for a reason.
Mhm.
And I do a weekly class on Zoom every Monday, and last week's was about inflammation. And inflammation is amazing stuff because it's a huge part of your body's healing process. Does it feel good? No. Does it take your energy? Yes. But if it's there, it's because your body is working hard to heal.
Mm.
And so by giving your body the tools that it needs to complete the healing, then the inflammation can go away. But if you're just fighting the inflammation, then you're shutting down your body's healing process. And so then you get sicker because then your body is going to bring back the inflammation because it's trying even harder to heal and you're like pushing it away. And so I love just teaching people that their bodies are really doing everything they need to be doing and they're doing the best they can to heal with the information that they have. I'm always working to get people better information and, that inner peace to know that their bodies are doing the right thing because so many of us, especially if we've dealt with chronic illness, we feel like our bodies are just fighting us all the time. And just being in that mindset, I feel can be really, really destructive. And so shifting the mindset is a huge thing.
100%. And I love that you've pointed that out. We often feel like, we're broken and we need to be fixed, or our body's given up on us, or all of the things you've probably heard in your practice as well. But really, the body hasn't given up on you at all. It is communicating with you. It is helping you see what you're not seeing, or helping you sort of create that path so that you can get to that optimal health. So I think that is really important to shift the mindset around that. And it's something I do in my Thrive program as well with my clients. Is we have a whole session on Ayurvedic psychology and empowering those belief shifts so that you can enhance your healing journey. Because a lot of people who have, especially chronic illnesses, and rightly so, have dealt with so much in their life and put up with a lot of pain and put up with social discomforts and all of the things that come with a chronic illness. So they feel that it can be a really personal thing between them and their body, and like talking about that as in being dissociated with the body and the body doing this nasty thing to you. So yeah, 100%. I really appreciate you bringing that up. I think that's a massive one when it comes to chronic illness. So with the people that you treat, are you mostly seeing people with autoimmune conditions and chronic illness? Is that sort of the type
Yeah,
of?
mostly.
Yeah.
Yep.
Yeah.
I find those are the a couple of the things that Western medicine has been really bad at addressing,
Mhm.
and
Chronic.
they often just don't know what to do.
Yeah.
And these people are often told, it's in your head or it's
Mm.
anxiety, and they're just given an anxiety medication, and so those they're not good solutions. And so those people are really seeking in a
Mhm.
lot of ways, and yeah, I wind up helping those types of people a lot. And
Yeah, beautiful. And just as you alluded to before, if you're not
so
treating,
magical.
yeah, and like, as you were saying, like if you're not treating that underlying reason for that inflammation and you're just treating the inflammation, that surface level, then it's going to keep reappearing and
Yeah.
communicating with you until you dive deeper and have that greater self-awareness. So that's
Mm.
fantastic. And I'd just love to speak on a few different conditions, because these are a lot of the conditions that I see with my clients, and I know a lot of women in the group have questions around this, but specifically people with thyroid, hypothyroidism, and they go and they get their TSH levels done and they're within optimal range, but an optimal range that we may like to see is between 0.5 and 2, whereas like from in Australia, I'm not sure if the ranges are the same, but I think ours normal goes up to 3.5 at the moment. Is that the same for you in America?
I think it's 3.0.
Okay, yeah.
But I would have to look at my notes, but it's somewhere around there. Yeah.
Yeah. So have you noticed, like, with people who have low thyroid symptoms and then they go to their GP and they get their TSH level, which is a thyroid test done, but it's actually from your pituitary, not your thyroid, and it's on the higher level. How are you managing that when you're like, yeah, well, it's 3 or above 3 and from my perspective it's too high, meaning that you've got a lower thyroid function?
So I look at it, I look at the whole piece, not just the thyroid. I would also look at the complete blood count, all the metabolics, all of that stuff. And what I find is there's kind of an order of operations. So lots of times when you clear the infections and reset the gut, the thyroid straightens out. Because one of the things that will mess with the thyroid is, of course, like you already mentioned, the pituitary being off and not producing TSH as it should. But that can also come from the hypothalamus not functioning well. And all of that relates back to stress. And so I see us all as having like this stress threshold. And when we are up there at the threshold, we can't function very well. And if we're above it, we're like done. But so many of us who have all these infections going on, our inner stress is so high that we can't handle any outside stress. And so when you start clearing those infections, the stress levels overall go down, because that's another thing that a lot of my clients get from their doctors is, oh, well, you just have to reduce stress in your life. Well, how do you reduce stress in your life if you have like kids and a career and all this stuff? Like, what are you going to cut? Like, there's nothing you can cut. Like, I can't imagine having to reduce stress in my life right now as a parent and an entrepreneur and, a homeowner and all of these things. Like, I can't do that. But most of us are so close to that threshold because we have so much inner stress going on, because our bodies are working so hard to fight infections, to heal whatever is going on. So when you heal that stuff, often the thyroid and hormonal things and all of that stuff evens out because your body's not so stressed. So I will address the thyroid later if it needs to happen. But the first priority is clearing out all that inside stress so that things can go back to normal function. And yeah, that's my perspective on that.
It's a very good perspective. It's wonderful. Yeah, thank you for sharing that. I'm also interested to hear why you think there's so many like undiagnosed infections going on, like, because you're seeing a lot of these infections through your pathology. So do you like wonder why there's so many?
Well, I'm not really sure like why MDs aren't reading those, but they're not like necessarily raging infections. They can be kind of underlying and be so long term. Like, so many people who are chronically ill, they've been having symptoms since they were little. Like, for me, it was age 4 that I remember. I mean, it could have been younger than that. I could have gotten it from my mom. She had really bad infections before she got pregnant with me. Maybe some of that was still lingering and I was born with this stuff, And so I think it's just getting overlooked. And if you, like, I've my training in the functional blood work, it really dives deep into the details of all the different types of white blood cells. And if you're not looking at those numbers, at like the percentages, then it can be really easily missed. Like if you're just looking at the white blood cell count, you might not even see an infection there. But if you go down and you see, oh, eosinophils are like 6%, they
Mm,
should be less than 3. If they're 6, which I find all the time, that person has lots of parasites going on.
mm,
And I don't think, I just think they're often not even getting looked at. I don't usually run people's blood work. I use what they have from, because most people have it already, and I don't want to cause more stress in people's lives. So use what they already have. But lots of times, even if they do have the differential, which is that breakdown of the different types of white blood cells, the eosinophils and basophils are left off. And those are the parasitic indicators. So like they're just not even being looked at. And I
mm.
don't know why. It doesn't make sense to me. But I look at them, so I'm always here for another opinion if people are curious.
Amazing. And whilst we're on like functional pathology, I would really love just to touch on hormones,
Mhm.
um, because women's hormones specifically talking about here, our hormones vary day to day. And so it really, when people go and get their hormones tested from the GP, it really does depend on why you're testing your hormones and what
Mhm.
you are testing for. Like, is it menopause, fertility? Like, are we looking at ovulation? And some tests such as like FSH and LH and estrogen and even prolactin, they should all be tested more like towards day 3, depending on what you're looking for. And
Yeah.
progesterone, you test generally after ovulation, so 7 days after
Yeah.
ovulation. So, can you speak more on this and when you're looking at a hormone profile, what you're looking for? And do you use the Dutch tests as opposed to the pathology test? And for those listening, a Dutch is dried urine test for hormones.
Um, like I've said before, I will use whatever people already have. So I can read both, if it's from the blood or the urine or whatever. Um, and but again, similar to the thyroid, there are so many precursors to hormonal health
Mm,
that I want to fix those first. So, blood sugar regulation is a huge thing when it comes to hormones. So, I want to make sure that we get some stable blood sugar going on.
mm,
And again, clearing the infections, because inflammation is a huge indicator for, or a huge, has a huge effect on hormones. And so when you clear the infections and that inflammation and stress goes down, often the hormones regulate. Um, there are herbal things too that will help regulate hormones, but that's always something that I look at later, because so much of the time, just regulating the blood sugar and getting that inside stress down, the hormones go back to how they should be.
mm,
So, so it's often not as much of an issue as it seems like. I get really frustrated when people, their hormone levels are off and they're like, "Oh, you need hormone replacement. Here's some estrogen or here's some testosterone." I'm like, "But you didn't even look at the whole like cascade before that." Because I always want to dig to the next layer, like, you have this symptom, but why?
mm,
Or these numbers are off, but why? What else affects those numbers? And so with things like hormones and thyroid, there are so many other things that affect those processes that I want to look at those first and address them if they're out of balance, so that your body can do its own regulation. Because if you go and do something like give someone a thyroid medication or give someone some hormone replacement or whatever, when that's not the actual problem, then you throw off all the things that are happening before, you
mm,
know? So if you give someone estrogen, then their body, might say, "Oh, I don't need to produce DHEA anymore. So,
mm,
so let's chill out on that." Because that's one of the precursors for estrogen, and so on. And the same with the thyroid. If you give someone a thyroid medication, then their pituitary might stop producing TSH. And so then the pituitary is thrown off. And then if you look before that, there's hypothalamus, and like, so it throws off that whole progression.
Mm.
And so I want to start like way before that, way before you get to things like thyroid or hormones.
Beautiful. And just before we go, I won't keep you too much longer, but is there a case study that really sticks out to you that, they've come in with feeling like they've done all the things, they've had all the bloods, they're all normal, but you've discovered something can help them in some way and they've just got wonderful results? I always love sharing these wins with everybody to give people hope.
Oh, so many, but I guess one of my favorites is a woman who's a long history of Lyme disease, super high stress, and then recently got diagnosed with lupus. And for the past year and a half, she just hasn't been able to do anything. She's pretty much just been laying on the couch being miserable. And so I started working with her just 2 months ago and, read her labs, and she had low iron, low vitamin D, bacterial, fungal, parasitic, and viral infections. And one of the indicators for lupus is the anti-nuclear antibody, which is common in lots of autoimmune disorders. And I'm like, well, no wonder your antibodies are going a little crazy because you have all of these infections.
Mm.
So we jumped right in to my protocol. First month was doing some stabilization and then clearing the infections and then resetting the gut. So she's only 2 months in, and now she's like hanging out with friends again and calling them. And she started volunteering at the library. And she's not like saying, "Oh, my whole life has changed," but the things she's doing, you can see that she's feeling so much better. And she did say she was feeling a lot better and she's not just on the couch all the time anymore, but that she's getting out and doing things. That was like such a huge, huge thing to see. And I find that is a big commonality, that once people start clearing these things and doing the reset, then they're getting more inspired to live, and maybe changing something that they were bored with, or not like something about their business that they didn't really like anymore. They're like, oh, but I could do it this way. Or getting off the couch and starting to get out there again. So
Mm, absolutely. When you optimize your health, like so much is possible for you. So it's such a wise goal to achieve. So I love that. Thanks for sharing.
yeah.
And where can the listeners find you if they would love to learn more about functional medicine, work with you? Where can they find you?
Probably the easiest is to head to my website, which is drelizabethdavidson.com. The doctor is just DR, it's not spelled out. And there you can find links to my YouTube, my Instagram, all of that. I post my class that I teach on Mondays to YouTube each week. So you can find recordings there, or you can join me for free. Um, Mondays, well, I don't know what it is in Australian time, but it's 1 p.m. Eastern US time. And so you can find links to all of that on my website.
Beautiful. Thank you. And we'll put your website in the show notes as well. So thank you so much. Is there any parting words or advice you would like to give us before we go?
And I guess my number one tip for people is to just take at least 10 minutes a day just for yourself, just to reflect, and put your phone away, make sure your kids and whoever else is in your family or life know that that is just for you. If you can make it longer, do it. But just to reflect and have some peace. And if you're having symptoms, take that time to reflect on why, because symptoms always have a good reason. And but really just taking that time for yourself, it starts to change your brain so that you are making yourself a priority. And I find that is a big commonality with people who have chronic and autoimmune disorders, is that they haven't been making themselves a priority. And it's important.
Amazing. Thank you. Thank you so much for sharing your wisdom and having a chat with us today. I really, really appreciate it. And like I said, I love getting into this kind of stuff. And I think it's so important to bring the information to people to really help. Yeah. So
Yeah.
thank you.
Thanks so much.